Societal lie confrontation. You've been lied to your entire life. They told you that sexual desire fades with age, that intimacy becomes inappropriate for seniors. They were dangerously wrong. Layer 2, medical reality revelation with transition, but here's what no one said. After 60, sexual inactivity, whether by choice or circumstance, could be the difference between thriving and rapid decline, between vitality and premature aging. The silence around this topic has created a health crisis hiding in plain sight. Clinical authority with institution my name is Dr. Sarah Mitchell, geriatric urologist and professor at Stanford Medical School. I've spent 30 years treating aging patients, and I've witnessed what happens when good people accept sexual shutdown as inevitable. What I've learned will challenge everything you believe about aging and health. Silent consequence warning. I've seen silent consequences destroying health, accelerating aging, and shortening lives, not from illness or genetics, but from what they believed was normal sexual retirement in their golden years. The medical community has failed to warn you about what's really happening to your body. Wrong method versus abstinence revelation, because the truth is, most seniors either stop all sexual activity or maintain it poorly, and both choices are quietly destroying their bodies and minds. Society taught you to be ashamed of sexuality after 60, but your biology doesn't understand cultural rules. Biological consequence spectrum, yes. Sexual inactivity causes hormone collapse, cardiovascular decline, immune system failure, and cognitive deterioration. But maintained properly, sexual activity literally extends lifespan and protects against age-related diseases. Your body is still designed to thrive through sexual health maintenance. Content promise with life change stakes in just a moment. I'll share 7 devastating consequences of sexual inactivity that every senior should have known decades ago, consequences that are completely preventable. This information could add years to your life and life to your years. Curiosity gap with life impact. Stay with me. What you're about to hear might fundamentally change how you approach the remaining years of your life. Specialized content positioning. Before we continue, make sure to hit subscribe and ring the notification bell. This channel delivers honest, science-based insights about aging and health that most doctors are too uncomfortable to discuss openly. We tackle the topics that matter most for healthy aging, even when they challenge social norms. Shame-free engagement system. If this topic resonates with your situation or concerns, type the number 1 in the comments. If you're here for general aging health information, type 0. Your feedback helps me create content that actually serves seniors. There's no judgment here, only medical facts and compassionate care. Authority transition. Now let's get into it, starting with the first devastating consequence that begins happening within weeks of sexual shutdown. This will shock most people. A 68-year-old retired nurse came to me after her husband's death 2 years earlier. This was a woman who had cared for others her entire career, but she was struggling with changes she couldn't understand. She sat in my office looking exhausted and said, "Doctor, I know grief takes time, but this feels different. I have no energy, my bones ache constantly, I can't sleep through the night, and I feel like I'm aging in fast forward. My friends say it's normal for widows, but something feels fundamentally wrong with my body." When I asked about her sexual activity since her husband's passing, she looked embarrassed and shifted uncomfortably. "I haven't. I mean, that part of my life ended when he died. I assumed that was appropriate, even healthy. I thought focusing on other things would help me heal." Margaret had no idea that sexual shutdown was accelerating her aging at the cellular level, creating a cascade of hormonal destruction that was literally stealing years from her life. The hidden biological damage. Sexual activity, whether partnered or solo, directly stimulates hormone production through multiple biological pathways that most people never understand. Physical arousal, anticipation, and orgasm trigger cascades of hormones that maintain cellular repair, immune function, and tissue health throughout your entire body. When sexual activity stops completely, this hormonal stimulation disappears overnight. Your body interprets sexual inactivity as a biological signal that reproductive hormones aren't needed anymore, so production plummets dramatically. This isn't just about libido. These hormones regulate bone density, muscle mass, skin elasticity, cognitive function, and cardiovascular health. Research shows that sexually inactive seniors experience 40 to 60% faster decline in sex hormones compared to sexually active peers of the same age. Testosterone drops precipitously in men, while women experience accelerated estrogen decline that affects far more than reproductive function. It impacts every system in your body. This hormonal collapse creates a devastating cascade of aging acceleration. Muscle wasting occurs rapidly, bone loss accelerates dangerously, skin ages visibly, cognitive function declines measurably, and immune system weakening makes you vulnerable to infections and diseases. Your body essentially receives biological signals to begin shutting down non-essential systems, and unfortunately, sexual health gets mistakenly categorized as non-essential when it's actually fundamental to healthy aging. The cascading consequences hormone collapse affects every body system simultaneously, creating a perfect storm of accelerated aging. Bone density decreases rapidly, increasing your risk of fractures from simple falls. Muscle mass deteriorates quickly, leading to frailty and loss of independence. Skin becomes thin and fragile, healing slowly from minor injuries. Sleep quality plummets because sex hormones regulate sleep cycles and circadian rhythms. Without these hormonal signals, your body loses its ability to achieve deep, restorative sleep phases that are essential for cellular repair and recovery. Cognitive function suffers dramatically as sex hormones support brain health, memory formation, and neural protection. Many seniors develop what appears to be early dementia when the real issue is hormone-related cognitive decline from sexual inactivity that could be completely prevented. Immune function weakens dramatically, making you susceptible to infections, slow wound healing, and increased cancer risk. Your body's ability to repair daily cellular damage diminishes because the hormonal signals for maintenance and repair have been eliminated through sexual inactivity. The psychological impact compounds all the physical decline. Loss of energy and vitality affects mood, motivation, and will to engage with life. Depression becomes more likely as hormone-supported emotional regulation fails, creating a downward spiral of declining health. Whether partnered or solo, to preserve hormonal stimulation that's essential for healthy aging. This isn't about performance or romance. It's about endocrine system maintenance for longevity and vitality. For widowed or single seniors, masturbation becomes essential healthcare, not optional pleasure. The physical arousal and climax provide the exact biological signals needed to maintain hormone production and prevent accelerated aging. The key is consistency. Sexual activity 2 to 3 times per week provides optimal hormonal support for seniors. Think of it as hormone replacement therapy through natural biological processes that your body is designed to respond to. For couples, maintaining intimacy despite physical changes becomes a medical necessity for both partners' longevity and health. Adaptation and creativity become healthcare strategies, not luxury preferences. Link bridge to next item. Maintaining hormonal health through sexual activity is crucial for preventing accelerated aging, but sexual inactivity damages more than hormones. It literally rewires your cardiovascular system in ways that dramatically increase your risk of heart disease and stroke. Patient confession opening. Robert, a 72-year-old retired engineer, came to me after his cardiologist found concerning changes in his heart function during a routine checkup. His cholesterol was well controlled, he exercised regularly, and he didn't smoke or drink excessively. Doc, I don't understand it. I've done everything right for my heart health. Good diet, regular walking, taking my medications religiously. But my cardiologist says my blood vessels look like someone 10 years older than me, and my circulation tests are concerning. When we discussed his lifestyle changes since his wife moved to memory care 3 years earlier, Robert mentioned, well, obviously the intimate side of our marriage ended years ago when her condition worsened. I figured that was just part of aging gracefully and accepting life's changes.
Robert didn't realize that sexual inactivity was quietly undermining all his other cardiovascular health efforts, creating arterial damage that no amount of walking or heart-healthy eating could fully counteract. The hidden biological damage. Sexual activity provides unique cardiovascular benefits that cannot be replicated through other forms of exercise, no matter how dedicated you are to traditional fitness routines. During arousal and orgasm, your heart rate increases in specific patterns, blood vessels dilate throughout your entire body, and circulation improves to areas that other exercises don't adequately stimulate. Regular sexual activity maintains endothelial function, the critical ability of blood vessel walls to expand and contract properly in response to circulation demands. Sexual arousal releases nitric oxide, a powerful compound that keeps blood vessels flexible and responsive throughout your cardiovascular system. Without this regular stimulation, vessels become increasingly stiff and less responsive to circulation demands. This isn't just about major arteries. Sexual activity improves circulation to small vessels throughout your body, including those that supply your brain, organs, and extremities. The cardiovascular workout from sexual activity is particularly beneficial for seniors because it provides natural interval training for the heart without high-impact stress on joints or bones. The combination of anticipation, arousal, and climax creates natural cardiovascular conditioning that supports healthy blood pressure and optimal circulation patterns. Studies show that sexually active seniors have 50% lower rates of cardiovascular events compared to sexually inactive peers of the same age and health status. Sexual activity literally exercises your circulatory system in ways that prevent age-related cardiovascular decline and protect against heart attacks and strokes. The cascading consequences. Cardiovascular decline from sexual inactivity affects every organ system in your body because everything depends on adequate blood flow and circulation. Poor circulation leads to cognitive decline as brain blood flow decreases, affecting memory, processing speed, and decision-making abilities. Kidney function suffers as renal circulation deteriorates, potentially leading to toxin buildup and electrolyte imbalances. Wound healing slows dramatically as peripheral circulation weakens, making even minor cuts and bruises heal poorly. The increased risk of heart attack and stroke becomes statistically significant within months of sexual shutdown. Your cardiovascular system loses the regular exercise that keeps it responsive and healthy, leading to arterial stiffening and reduced circulation capacity. Blood pressure often increases as vessels lose flexibility and responsiveness. Cholesterol management becomes more difficult as circulation stagnates, allowing arterial plaque buildup to accelerate. Many seniors develop circulation problems in their extremities, cold hands and feet, poor wound healing, and decreased sensation that affects balance and coordination. The psychological impact includes chronic fatigue, brain fog, and decreased motivation as poor circulation affects energy levels and cognitive function. You may feel older and more frail simply because your circulatory system isn't receiving the stimulation it needs to maintain optimal function. The correction method. Maintaining cardiovascular health requires regular sexual activity to stimulate circulation and preserve vessel flexibility. This doesn't require athletic performance. Even gentle sexual activity provides significant cardiovascular benefits and protection. For seniors with physical limitations, the focus should be on arousal and circulation stimulation rather than performance metrics. Even modest sexual activity provides measurable cardiovascular protection that complements other heart-healthy activities. The goal is regular heart rate elevation and circulation improvement through sexual arousal. 2. 3 times per week. This natural form of cardiovascular exercise complements other heart-healthy activities and provides unique benefits that traditional exercise cannot replicate. Protecting your cardiovascular system through sexual activity is vital for longevity, But sexual inactivity also devastates your immune system in ways that make you vulnerable to infections, cancer, and autoimmune diseases. The immune consequences might surprise you. Opening Dorothy, a 69-year-old retired teacher, came to me after experiencing her fourth serious infection in 6 months. She'd battled pneumonia twice, recurring UTIs, and skin infections that wouldn't heal properly despite antibiotic treatments. Her primary care doctor couldn't understand why her immune system seemed to be failing so dramatically. "Doctor, I used to never get sick. I was the teacher who worked through everything while my colleagues called in with every little bug. Now it feels like I catch everything that's going around, and it takes forever to recover. My doctor ran extensive tests for immune disorders and cancer, but everything came back normal." When we discussed lifestyle factors that might be affecting her immune function, Dorothy mentioned that she'd closed that chapter of her life after her divorce 4 years earlier. "I just decided to focus on other things, my grandchildren, volunteering, staying busy. I thought that was healthier than dwelling on those needs." Dorothy had no idea that sexual inactivity was systematically weakening her body's ability to fight off infections and diseases, leaving her vulnerable to every pathogen she encountered. The hidden biological damage. Sexual activity provides powerful immune system stimulation through multiple biological pathways that are essential for maintaining disease resistance as we age. During arousal and orgasm, your body releases immunoglobulin A, IgA, which serves as your first line of defense against infections entering through mucous membranes. Sexual activity also stimulates the production of white blood cells and natural killer cells that fight cancer cells and infections throughout your body. The hormonal cascades triggered by sexual activity include immune-boosting compounds like DHEA, growth hormone, and endorphins that strengthen your body's defensive capabilities. Research demonstrates that sexually active seniors have significantly higher levels of protective antibodies and stronger immune responses to vaccines compared to sexually inactive peers. Sexual activity literally trains your immune system to stay active, alert, and responsive to threats. Without regular sexual stimulation, immune function deteriorates rapidly and predictably. Your body's ability to recognize and eliminate threats diminishes week by week, making you increasingly susceptible to infections, slower wound healing, and increased cancer risk throughout your body. The immune system interprets sexual inactivity as a biological signal to reduce defensive vigilance, essentially telling your body that it doesn't need to maintain peak immune readiness anymore. The cascading consequences. Immune system decline makes seniors vulnerable to every health threat in their environment. Simple infections that would have been easily fought off become serious complications requiring medical intervention. Wounds heal slowly and are prone to secondary infections that can become life-threatening. Cancer screening becomes more critical as immune surveillance weakens, reducing your body's ability to detect and eliminate abnormal cells before they develop into tumors. Autoimmune conditions may worsen as immune regulation becomes imbalanced and unpredictable. Allergies and inflammatory conditions often intensify when immune function is compromised, leading to increased medication needs and reduced quality of life. The increased susceptibility to illness creates a vicious cycle of declining health and vitality. Frequent infections lead to repeated antibiotic use, which further disrupts immune balance and gut health. Recovery time increases dramatically, leading to decreased activity levels and further health decline across all body systems. Vaccine effectiveness decreases when immune function is poor, making protection against diseases like flu, pneumonia, and other preventable illnesses less reliable just when you need it most. The correction method. Immune system protection requires regular sexual activity to maintain immune-boosting hormone levels and antibody production. This natural immune support cannot be replicated through supplements, medications, or other interventions.
The immune benefits begin within days of resumed sexual activity, with measurable improvements in immune markers appearing quickly. Regular sexual stimulation 2 to 3 times per week provides optimal immune system support for seniors. For those without partners, solo sexual activity provides identical immune benefits. The biological immune stimulation occurs regardless of whether activity is partnered or individual, What matters is consistency in maintaining sexual arousal and climax. Bridge to next item: protecting immune function through sexual activity is essential for disease resistance, but perhaps the most devastating consequence of sexual inactivity is what happens to your brain. The cognitive decline that follows sexual shutdown often gets misdiagnosed as normal aging. Harold, a 74-year-old retired pilot, came to me genuinely worried about his memory and mental sharpness. His family was expressing concern about early signs of dementia, forgetting familiar names, losing track of conversations mid-sentence, and difficulty with complex tasks he'd performed easily for decades. "Doc, I'm scared. My father had Alzheimer's, and I'm seeing similar signs developing in myself. But I'm only 74, and I've always been sharp as a tack. I could navigate complex flight plans and manage multiple systems simultaneously. Now I can't remember where I put my keys." Harold's cognitive testing showed some decline, but not severe enough for a dementia diagnosis. When we explored lifestyle factors that might be affecting his brain function, he revealed that he'd stopped all sexual activity after his wife's death 5 years earlier. "I thought that part of life was over," he said quietly. "It seemed appropriate to let it go with her." Harold had no idea that sexual shutdown was directly contributing to his cognitive decline and dramatically increasing his dementia risk. The hidden biological damage sexual activity provides crucial cognitive protection through multiple neurological pathways that are essential for maintaining brain health as we age. During arousal and orgasm, your brain releases BDNF, brain-derived neurotrophic factor, which promotes the formation of new neural connections and protects existing brain cells from age-related damage and degeneration. Sexual activity dramatically increases blood flow to the brain, delivering oxygen and nutrients essential for optimal cognitive function. This increased cerebral circulation cannot be achieved through other activities and is particularly important for seniors whose brain circulation naturally declines with age. The complex neurological processes involved in sexual response exercise multiple brain regions simultaneously, maintaining cognitive flexibility, processing speed, and executive function. This neural exercise is unique and cannot be replicated through puzzles, reading, or other brain training activities. Sex hormones stimulated by sexual activity, testosterone, estrogen, and others, directly protect brain tissue from inflammation and oxidative damage that accelerate cognitive decline. These hormones support memory formation, executive function, and emotional regulation at the cellular level. Research shows that sexually active seniors have significantly lower rates of cognitive decline and dementia compared to sexually inactive peers of the same age and health status. Sexual activity literally exercises your brain in ways that preserve cognitive function and protect against age-related neurological deterioration. The cascading consequences cognitive decline from sexual inactivity affects every aspect of daily life and independence. Memory problems interfere with medication management, financial decisions, and social interactions that were previously automatic and effortless. Executive function decline makes complex tasks overwhelming and frustrating, leading to withdrawal from activities that once provided satisfaction and purpose. The loss of cognitive sharpness affects confidence and independence, creating a downward spiral of decreased engagement. Family relationships suffer as communication becomes more difficult and frustrating for everyone involved. Partners and adult children may interpret cognitive changes as inevitable aging or early dementia, when the real issue is preventable brain decline from sexual inactivity. The fear of further decline creates anxiety and depression, which compound the cognitive problems through stress hormones that further damage brain function. This creates a destructive cycle of mental decline that accelerates over time. The correction method cognitive protection requires regular sexual activity to maintain brain protective hormone levels and neural stimulation. The complex neurological processes involved in sexual response provide unique cognitive exercise that cannot be replicated through other mental activities. For optimal brain protection, sexual activity 2 to 3 times per week provides measurable cognitive benefits that become apparent within weeks. The neurological stimulation from arousal, anticipation, and climax maintains neural pathways and promotes new brain cell formation. Even seniors with mild cognitive decline can benefit significantly from resumed sexual activity. The brain's plasticity allows for recovery and protection when proper stimulation is restored through consistent sexual activity. Link bridge to next item: protecting cognitive function through sexual activity is crucial for maintaining independence and quality of life. But sexual inactivity also affects your body's ability to sleep properly, creating a cascade of health problems that accelerate every aspect of aging. Identity restoration opening, my friends. I want to speak to you not just as a doctor, but as someone who deeply respects the lives you've built and the wisdom you've accumulated over decades of experience. The consequences we've discussed today: hormone collapse, cardiovascular decline, immune failure, cognitive deterioration, sleep disruption, accelerated aging, and loss of life force, none of these are inevitable parts of aging. They're not the price of aging gracefully. They're not what you owe to society's expectations or cultural propriety. They're simply the biological consequences of abandoning a fundamental aspect of human health and vitality that your body still needs and responds to. Your body doesn't understand cultural expectations about aging and sexuality. It only understands biological signals and responds accordingly. When those life-sustaining signals stop, your body begins the process of systematic shutdown. But you have the power to change those signals and reclaim your vitality. You deserve to feel alive, vital, and engaged with life for as long as you're breathing. Your sexuality isn't a luxury or indulgence. It's a medical necessity for healthy aging and longevity. Mistake summary: with dignity restoration today, we've uncovered 7 devastating consequences of sexual inactivity: the hormonal collapse that accelerates aging at the cellular level, the cardiovascular damage that threatens your heart and circulation, the immune failure that makes you vulnerable to disease and infection, the cognitive decline that robs your mental sharpness and memory, the sleep disruption that prevents recovery and repair, the accelerated aging that shortens your lifespan, and the loss of life force that makes existence feel empty and purposeless. Each of these consequences represents a choice, not an inevitable sentence of aging. Your body is still capable of response, healing, and vitality when given the proper biological signals through regular sexual activity. You're not too old for sexuality. It's not too late to reclaim your vitality, and you're not being inappropriate by maintaining your sexual health. You're being medically responsible for your own health, longevity, and quality of life. The cultural messages that tell seniors to abandon sexuality are medically dangerous advice that's creating entirely preventable health crises throughout our aging population. Your body needs sexual activity to maintain optimal function throughout the aging process. Body connection restoration: your body has been waiting patiently for you to give it what it needs to thrive. Every hormone-producing cell, every blood vessel, every neuron is still there, still capable of response when properly stimulated through sexual activity. This isn't about performance or romance, though those may return as welcome side effects. This is about biological maintenance, cellular repair, and life force preservation that extends both the quantity and quality of your remaining years. You have the right to feel good in your body, to experience pleasure, and to maintain the neurochemical foundations of vitality and joy. Age doesn't eliminate these rights. It makes them more precious and medically necessary. Your sexuality is an integral part of your life force. Protecting it means protecting your health, your longevity, and your will to live fully and vibrantly. Practical implementation plus identity affirmation start where you are with what you have available to you. Whether you have a partner or are alone, whether you're dealing with physical limitations or feeling completely shut down sexually, there's a path back to vitality and health. Begin with the understanding that sexual activity is essential healthcare, not indulgence or luxury. Approach it with the same commitment and consistency you'd give to taking prescribed medications or maintaining other health routines. You're not trying to recapture your youth, you're claiming your present health and future vitality. You're not being selfish by prioritizing your sexual health, you're being responsible for your own well-being and the quality of your remaining years. Your vitality, your health, and your life force are absolutely worth fighting for. Now it's time to reclaim what's rightfully yours and live fully in the body you have today.